government right now making our healthcare system work. They have nothing to do with it. But all of a sudden, for some reason, enough people, it's not a majority, but clearly a lot of people think this man is qualified to manage all this, to design this and manage it. I want to play one more Obama soundbite, play it again here, because I think in this soundbite, he's got a question. Am I going to be able to see a cardiologist if I have a heart condition or other specialist, or is that all going to be primary care? I'm calling it rationing of care. That's the question, and here's his answer. And I think in this answer, we don't even need doctors. We're not even going to need them. Listen to this answer.
I do think this is a concern that people have generally. My interest is not in getting between you and your doctor, although keep in mind right now, insurance companies are often getting between you and your doctor. What we've said is we just want to provide some guidelines to Medicare and by extension, the private sector, about what works and what doesn't.
Okay,
some of you may have heard...
We don't need doctors. Just put out the list of what works best. Just put a list out. Medicare can handle this, right? Just put out a list of what works best and have somebody do that. President of the United States, I don't want to get between you and your doctor. That's something Mikhail Gorbachev would say. Except they didn't have many doctors over there. Fred in Cleveland. Hello, sir. Welcome to the one and only EIB network.
Rush, it's a true honor. Mega dittos from a conservative entrepreneur in Cleveland.
Thank you very much, sir.
You got it. My point is, I think that our president and his liberal agenda and his Chicago thug politics are coming to a head, and I think that the American people are finally waking up, and I think the door's been open over 30 or 40 years of them manipulating our education. I think Obama's trying to kick the door wide open, and I think it's too early and too soon. I don't think they have the power to do it, and I think people are coming alive and realizing what his true agenda is, and we're going to put a stop to it. I think if we can win some seats in 2010.
Let me tell you something. I do believe this. I do believe more and more people are saying this is not who we thought we were voting for. We thought we were voting some magical post-racial, postpartum, post-partisan, I said it on purpose, politician. And they're not, this is not who people voted for. But he doesn't care. He can see the polls now, Fred. He can see that nobody wants his plan and that nobody wants his cap and trade plan. That's not going to stop him. Whether or not, I think there have been so many instances in history where people should have seen the follies of liberalism that they would never, ever get elected in large numbers ever again. But they do. Because they are filled with deceit. Obama would not have gotten elected had this agenda been perfectly laid out as he's executing it. Wouldn't have stood a chance. That's why people are starting to say, this is not the guy I voted for. Then you've got some people just scared to death, like these poor people, these 40 or whatever was willing participants in the Tella town hall today. They're just scared that they're going to lose their medical coverage and treatment. And anything that they can hear that reassures them that's not going to happen, it may in fact get better, and a couple of millionaires are going to actually pay for it. At some point in your life, that's really all you care about. So anyway, this has been a great day for eye-opening. It's still shocking. We are at a perilous path. These are dangerous times in our country. I hope Fred from Cleveland is right about the number of people waking up. But as my good friend Michael Ledeen says, faster, please.